Obey, Mr. Welch. Are there others? Mr. Andrews, we'll begin with you.
Thank you, Mr. Chairman. I'd like to thank you and the Speaker and Chairwoman DeLauro for giving an honest and open and substantive process. I think it's one of the main reasons we're going to pass this bill. I thank the witnesses for their testimony. One of the reasons why health care out-of-pocket costs are going up at 3 times the rate of wages is the lack of credible competition in the insurance industry, as each of you has said. Now, responsible people, when they try to address that problem of lack of real competition, offer 3 alternatives. The first is opening up more interstate competition so that private insurers can cross state lines and compete. And Dr. Hacker, at the end of your testimony, when you talk about co-ops, you're skeptical that co-ops would succeed because they would face the same problems in breaking into markets that smaller private competitors face today. What are the major problems that private competitors face into breaking into markets that are not their home markets?
Well, the primary problem can be summed up as a chicken and egg problem. Right. If you do not have a substantial network of participating providers, it's almost impossible for you to gain subscribers, much less to get good rates. But it's very difficult to build a substantial network of providers when there are several large insurers that dominate the market already. In 9 states, the largest insurer enrolls more than 70% of the privately insured population. Some states like Alabama, that number is above 80%. 17 more states, bringing to 26 in total, right, have more than 50% of the market dominated by the largest private insurers.
If I understand your testimony, you're essentially saying that because it's so difficult to build a provider network,
exactly,
if today we just said any insurer can sell insurance in any state in the nation, it probably wouldn't work. It would increase competition.
No, because health insurance is a local service in the sense that no one wants to go to another state to see a doctor under their plan.
Now, if we said the same thing with co-ops, if we said let's have national co-ops, regional co-ops, state co-ops to induce competition, wouldn't they fail for the same reason?
They would indeed, and this isn't just my conclusion. This was the conclusion of investment analysts at the Oppenheimer Fund, who said that they thought that this would be a great thing for managed care companies if it could get off the ground, but that they, quote, thought little chance of success.
So how does the public option, as proposed in H.R. 3200, get around this problem of building a viable provider network and therefore inducing real competition?
It does it quite simply by building on the existing infrastructure of Medicare. And this is why I'm emphasizing that it's quite important to have a presumption of participation of providers who deliver services to Medicare beneficiaries. They would have the ability to opt out, as do providers who have in the past agreed to participate in Medicare.
Just gentleman's time has expired.
Thank you.
Mr. Doggett.
Thank you, Mr. Chairman. Dr. Hacker, thank you for your testimony, all 3 of you. Very excellent testimony.